Tuberculosis TB. What is TB? Tuberculosis TB is a serious infectious disease caused by the bacterium Mycobacterium tuberculosis that primarily affects the lungs. In simple terms, TB has following features. Pathogen. TB is caused by an airborne bacteria. Transmission. TB spreads through respiratory droplets by coughing, sneezing. Target organ. TB mainly attacks pulmonary tissue, the lungs. Systemic spread. TB can infect the spine, kidneys, or brain. Dual states. TB exists as either an inactive disease, latent, form of TB, or active disease. How long does TB stays hidden in our bodies? Incubation period. If you develop active TB, symptoms most commonly appear within a few weeks to 2 years after initial exposure. Latent dormancy. The bacteria can remain asleep, latent, in your immune system for decades or an entire lifetime without making you sick. Lifetime risk. About 5 to 10% of people with a latent infection will develop active TB disease at some point in their lives, usually when their immune system weakens. How long medication takes to treat TB? In case of active TB, we do standard treatment. Typical drug-susceptible active TB requires a strict regimen, lasting 4 to 6 months. In case of latent TB, to do prevention, modern preventative regimens take 3 to 4 months, using rifamycin-based short courses, though older methods took up to 9 months. For drug-resistant TB, if the bacteria resist standard drugs, treatment requires specialized oral regimens that can now be completed in a shortened 6-month period. Now, let's discuss the signs of TB. TB symptoms depend on whether the infection is latent, inactive, or active. People with latent TB have no symptoms and cannot spread the disease. Symptoms of active TB generally include prolonged cough. TB has a bad cough lasting 3 weeks or longer. Respiratory distress. TB patient coughs up blood or sputum, thick phlegm, and chest pain. Systemic signs. Patient has fever, chills, and drenching night sweats. General decline. Patient can have unexplained weight loss, loss of appetite, and extreme fatigue or weakness. Note: if TB spreads outside the lungs to other parts of the body, for example, lymph nodes, spine, or brain, symptoms can include swollen glands, body aches, or severe headaches. If you are experiencing a persistent cough, fever, or unexplained weight loss, seek medical advice promptly.